when I see a new patient, I ask some of the same things that I usually ask of a new patient. I ask, how they're doing, what they do during the day. I ask about their medicines. I ask about their allergies. But in addition, now what I do is ask them where they live. And if they live in one of these areas, I ask them if they have a well. If they have a well, I ask them if they have symptoms of numbness and tingling in their legs. And I ask if they have skin changes. And I always still worry about cancer in the lung, liver, bladder, skin. But if they have these situations, I frequently will have them just check their water now. And this is a very built-up, sophisticated area. And patients that I see that I call new, they usually aren't new. As I say, I still see mostly older folks. I started a geriatric clinic at Beaumont Hospital, and I'm happy to see people of all ages, but most of the people I see have seen a number of other doctors along the way. And maybe not 17, but a considerable number. So if I see they've had everything else checked, I'll tell them, go pay your $18, go to the health department, get your jug, put some tap water in it, take it back, and see what the number is. And if the number is high, we'll talk about what else to do. And I don't see a lot of new arsenic patients, but I see about one every year, something like that. And, I tell them to change their water by the ways we've discussed it and see how they feel. And most of these people don't feel 100%, but they feel a whole lot better. When I ask them, they'll say, they're 80% or 85% better. So I think that is a real accomplishment. I think that this is important. As you mentioned before, I may have just fell on the diagnosis or, what people may say, but the diagnosis was there just the same. And I think this is an important health matter for people in the past who have been helped, and I'm hopeful with our discussions on this today that the word will get out to other people who can also be helped for the health for the years to come. And I appreciate talking to you about this important issue.